want to talk about a topic that doesn't get enough attention, but should, because every woman deserves to understand what's going to happen to them down there as they age. So let's talk about this topic, and I want to bring to you and to anybody else who's listening the importance that we need to learn more about our anatomy. We need to understand what happens and maybe have some solutions if there are things that are bothering us. I'm Dr. Jen, double-boarded OBGYN in integrative medicine. If you want to hear more topics about perimenopause, menopause, sexual health, then please like and subscribe my channel. I am a double-boarded OBGYN and integrative medicine doctor, and I like to bring topics on anti-aging, longevity, all kinds of cool stuff, even things like red light therapy that are really kind of not only in Western medicine, but outside as well. So you can gain clarity and confidence in your midlife journey. So let's dive into this topic. First of all, a lot of women understand that things change as they age. When you go through midlife, you start noticing things not only look different, but they feel different, and they can affect your sexual health and your intimacy with your partner. So let's first kind of establish some anatomy, right? Because a lot of times we use the term like vagina, but really the vagina and the vulva and the clitoris and the urethra are all very, very different. So looking at sort of external genitalia, there's a picture here. The vulva is the external portion of the genitalia where you normally see hair. And then we have the labia majora, sometimes they're referred to as the larger lips. And then we have the smaller lips called the labia minora. And then we have the clitoris, which is this little area. It looks like a small pea-sized organ that actually is responsible a lot for orgasm and also just sensation in general. And this is sort of the external genitalia. So oftentimes people refer to this as vagina, but it's really not the vagina. The vagina is internal. It's the canal, the vaginal canal that leads at the end to the cervix, which is the opening of the uterus. So they're two anatomically different, and honestly, they're actually very different types of cells that reside on the vulva than the vagina. The vagina has more mucosal cells, so absorption of different medication is going to be very different than vulvar tissue. So when we talk about solutions, it's important to understand, are we talking about vulvar or vaginal concerns? Along with the anatomy, one thing people don't think about is in the vagina, there's lots of nerves, there's lots of glands that actually secrete fluids. Hence, when you're having orgasms, you need lubrication. And so that's also part of the vaginal anatomy. Okay, so now we've kind of cleared up vulvar versus vagina versus clitoris and all those sorts of components. Oh, I didn't say anything about the urethra. So urethra is the opening to the bladder. It's located right near the clitoris or the clitoral hood, and that's where pee comes out. So most people know the urethra because they may have gotten a UTI, but it's often we talk about those in this because in women, the distance between the urethra and the vagina and the anus are all very, very close compared to men. So women are more susceptible to UTIs because they have bacteria that can go from one area to the other. Okay, so what happens exactly in midlife? You may have heard my colleague, Dr. Rachel Rubin. She actually went viral on this post that she was talking about the labia shrink. Like they disappear, and it led quite a stir because what was funny about us to think about, like, where do they go? Like, what happened to them? So in midlife, as you start having declining of estrogen, testosterone, and progesterone, all of those tissues, both external genitalia and internal genitalia, have receptors for those hormones. In fact, the vagina has androgen and estrogen receptors, hence why we give vaginal estrogen and vaginal DHEA for things like dryness, burning with intercourse, pain, because we actually have both receptors. Those tissues are susceptible to both hormones. So when you look at sort of changes, there's several things that happen. When you lose estrogen in the vulvar tissues as well as the vaginal tissues, then the tissue becomes thin, pale. It loses its normal microbiome, which helps defend against bacteria. It loses the elasticity, so it becomes really friable and thin, and trauma can sometimes, people can notice they get cuts or scrapes or they're more susceptible to trauma to the tissue because it's thin and pale. The color changes. It's not bright pink anymore. It becomes white or whiter or paler in color as well. And then also you lose elasticity. And the elasticity is where then the labia minora, the larger lips, and the smaller lips start to kind of shrink or even notice sagging. So some women will notice, like, what is the deal? I look down there with a mirror and now suddenly things look kind of either shrunk, like shriveled a little bit, or sagging because you lose collagen, you lose elasticity, and the tissue becomes thin and pale. So not only does that affect kind of how things work, but it also affects how you see things. So let's first talk about how things work. So when you lose estrogen and progesterone and testosterone, then you often will lose sensation. You feel like it's kind of numb down there, like sex isn't as pleasurable anymore. But you can also experience things like dryness, which lead to pain because it feels like the friction, it's almost like sandpaper or cactus, women describe it. You can also notice that you have changes where things may bother you. You may be more sensitive to perfumes or underwear or different products because, again, you don't have that sort of defense mechanism that was there. From a changing perspective, often women can feel kind of like, what is going on? It doesn't look the same. Does my partner think that I look different? Does he still think I look attractive? Are there things that have changed that he may not be attracted to anymore? And honestly, I hear more women in my practice describe just feeling uncomfortable with what happens, the changes that happen. The pubic hair can also become more sparse. So women may notice they don't need to shave as often because it becomes thinner. And, obviously you can get gray hair in the pubic region as well as your head. And so women will often notice that sort of change as well. So when these things happen, then, it affects essentially lubrication, which is a part of orgasm as well. So women get less lubrication because those glands don't secrete as much fluid, and also they notice that that then affects their sexual health. So what can you do about this? Let's talk about it kind of in those systems again, what it looks like, how it functions or what's going on, and then lastly, just some in-office procedures if you choose to do that. So first of all, how it looks. When the tissue becomes pale and thin and you lose the normal bacteria that help defend you against UTIs and vaginal infections, then the number one thing that helps that is honestly estrogen. Estrogen replenishes the tissue. It stimulates collagen. It stimulates the blood flow to the tissue. It also helps the tissue become again, the bacteria, the normal microbiome that's in the vagina returns. And so you're able to defend yourself against urinary tract infections, vaginal infections. The tissue is not so dry, so pain isn't as uncomfortable. Sex isn't as uncomfortable because you don't have pain. And then most women notice better lubrication because, again, you need those glands to secrete fluid. Testosterone also is a very effective option as well. And we give that in the form of DHEA. There are actual products that are FDA approved that have DHEA, which is a precursor to testosterone. And that can be given also in the vagina as a cream or suppository. And that also works at the androgen receptors to help improve sensation, flow to the genitalia. And a lot of women actually notice that they have less symptoms of irritation. Let me back that up for a second. I didn't mention this term, which I think is really, really important. GSM, or Genitourinary Syndrome of Menopause. The things I'm actually describing are in the GSM category. In other words, the symptoms of menopause that affect your genital and urinary tract infections fall under GSM. So dryness, recurrent UTIs, recurrent bacterial infections, thinning of the skin, irritation, laxity, which is just sort of the tissue becomes less pliable and elastic, and then also the sensation changes, all are under GSM of menopause. Okay, back to sort of those changes that I was mentioning. So From a perspective of also changes, way things look differently, some women choose to do in-office procedures. So they may choose to actually do a labioplasty or make the labia not so droopy or saggy. They may choose to do brightening. They may notice skin color changes and they might want brightening serum. And there's also vaginal lasers, which help improve incontinence, laxity, sensation, and they overall, it's like the CO2 you do for your face. You actually improve the tissue. It wants to remodel or fix itself. Okay, so that's kind of the appearance or the changes that you see. From a perspective of how the vaginal tissue functions, you can not only use hormone replacement therapy, but you can also consider using lubricants and moisturizers. What's the difference? So lubricants actually help you have fluid in the vagina, so sex is more pleasurable, sex is more comfortable. It's essentially kind of providing the slip and slide so that things are more comfortable. Versus moisturizers are actually things that help bring moisture to the tissue. Often women will use this on the vulva, use vulvar moisturizers, and they contain ingredients like vitamin E and hyaluronic acid. You can also use moisturizers in the vagina, and those suppositories can have things like vitamin E and hyaluronic acid. Reverie by Bonafide is a perfect example that's available over the counter that works great for helping to provide moisture versus a lubricant, which often I discuss silicone-based lubricants like Uberlube, which I think is a great product, is just to allow you to have that comfort and help improve pleasure during sex. So not only can you use, again, for function and to kind of retain that function you had when you were younger, you can use hormones, both estrogen and testosterone in the form of DHEA. You can use lubricants to help have better sex. You can use moisturizer to help the tissue feel better on your day-to-day. And remember, moisturizers can be used multiple times per day. They can be used at night. They're often used in women who might, say, go on vacation and they're going to be somewhere where it's a beach location, so they want a little bit more moisture. And then lastly, you can actually look at options that are going to help with kind of improving blood flow as well. So there are there are compounded options like Scream Cream, which is actually a cream that you put on the clitoris that improves blood flow, similar to the concept of Viagra, and that can also help as well with function. Lastly, I want to say, I'm an integrative medicine doctor, and lifestyle is crucial. You can't do any of these things without lifestyle. So if you smoke, you need to quit. Smokers have a lot of changes associated with the skin, even down in the vulva and the vagina. That's really important. If you're someone who's not following a healthy lifestyle, such as good nutrition and exercise, you can also experience more symptoms. You could develop an autoimmune condition. So it's important that you're also having good, healthy nutrition and exercise as well. And then just taking care of the skin. A lot of women are sold these products over the counter about, douches and clean this and Kim Kardashian pineapple gummies to make your vagina smell like pineapple or whatever. And it's just too much. The vagina is a self-cleaning organ. You do not need to douche. You do not need to put fancy creams and lotions from Bath and Body Works or whatever location. You just need to use plain soap and water externally and keep it clean and dry, and use just everyday hygiene techniques. You don't need to do anything special. So if you're having any of these symptoms, please talk to your doctor or your provider, whoever you see, and discuss with them. There's so many things you can do, and I want to make sure that you know that this is also part of your overall women's health. The health of the vaginal tissue, the vulvar tissue, the skin down there is just as important as the skin on your face. We need to take care of both of those things. So please, I urge you to seek some help if you need to discuss what's going on. I would love to make more videos in this content about sexual health, about changes, about anti-aging. Put in the comments what you want to hear. I want to make videos that you want to hear. So let me know. And if you love this channel, please tell other people so that we can get more women the power, the clarity, the confidence that they need.